Why isn't my child talking yet? For many families, this question brings a heavy sense of dread and uncertainty. You watch your 2-year-old closely, waiting for them to say mama or papa, and feel a growing anxiety when milestones come and go in silence. When you voice these concerns, well-meaning friends and relatives are quick to offer reassurance. They tell you that boys speak late, or they remind you about a cousin who didn't say a single word until he was 4. They insist that every child develops differently. Looking at this split-screen chart, you can see the conflict clearly. On one side are those familiar, comforting phrases. On the other is the statistical reality from the World Health Organization. Approximately 1 in 100 children worldwide has autism spectrum disorder. Accepting the advice to simply wait and watch offers an immediate trade-off. It provides temporary peace of mind and relieves the intense anxiety of the moment, allowing you to go back to hoping for the best. But that temporary relief comes with a consequence. It shortens the time available during the first few years of life, when a child's brain is most adaptable and responsive to learning. During these first few years, the brain forms neural connections at a rapid pace. This specific window of development is when a child is most capable of acquiring the building blocks of communication. If a child's silence is actually a sign of autism or another developmental condition, delaying a professional evaluation has a direct cost. It deprives the child of structured support during their most significant period of brain growth. This creates a difficult dilemma. How can you definitively tell if your child is simply a late talker who will eventually catch up, or if they require immediate medical intervention? To find the answer, we have to look beyond the presence of spoken words and examine the specific ways a child attempts to connect and share experiences with the people around them. Child development is not a race, and small variations in timing are common. However, medical milestones provide a set of specific markers that allow parents to measure progress against established developmental data rather than relying on guesswork. This milestone timeline shows early stages. Between 0 and 6 months, communication emerges through laughing, cooing, and babbling. By 9 to 18 months, expectations shift to active engagement. A child should be waving, pointing, and using 10 to 20 words. Ignoring these specific markers can lead parents to miss underlying issues that require a simple fix. A problem like hearing loss can quickly become a severe obstacle to learning if it goes unnoticed during these early years. Tracking these milestones also helps identify developmental red flags. The most critical red flag is regression, when a child loses words or social skills they had already mastered. Missing a milestone is not a final diagnosis. It is an objective signal that it is time to stop hoping for the best and start consulting a healthcare professional. This direct comparison matrix separates an isolated speech delay on the left from autism spectrum disorder on the right. Regarding social interaction, a child with a speech delay usually maintains strong eye contact. They use gestures to compensate because they still want to engage. By contrast, a child on the autism spectrum often avoids eye contact, prefers isolated play, and lacks those foundational nonverbal communication skills. Next is joint attention. A speech-delayed child will frequently point at objects, like a passing airplane or a toy, simply to share their interest with a parent. An autistic child frequently fails to point at objects to share experiences, and they will often respond inconsistently when their name is called. These differences dictate entirely divergent treatment paths. An isolated speech delay may only require focused speech-language therapy. Autism demands a comprehensive approach that typically includes occupational therapy and structured parent coaching. A child with a speech delay wants to communicate, but lacks the verbal tools to do so. Autism affects how a child perceives and initiates social interactions in the first place. It is important to remember that a speech delay is a symptom, not a root cause. The delay can stem from a wide range of factors, including premature birth, oral motor difficulties, or underlying neurological conditions. This decision tree shows when to act. If your child is between 18 and 24 months old and lacks eye contact, does not point, or ignores their name, you are in a high-risk scenario. Immediate developmental screening is mandatory. If your child understands instructions, uses gestures effectively, and enjoys social interaction but simply lacks vocabulary, the risk is lower. An evaluation is still needed to provide support, but there is no need to panic. Taking the effort to uncover the exact root cause right now prevents years of developmental difficulty and ensures you don't waste resources on the wrong interventions. Consider two children, Arav, who was diagnosed with autism and required comprehensive interventions, and his neighbor, who had an isolated speech delay and only needed speech therapy. Both children presented with the exact same symptom, delayed speech, but they needed different paths to reach the same goal of effective communication. Realizing your child needs help is stressful, and deciding which type of doctor, therapist, or specialist to consult first can be overwhelming. KareSpecial is designed to simplify that journey. It brings trusted developmental information, therapy support, and connections to qualified professionals together in one unified platform. Early intervention changes a child's developmental trajectory. Taking action today provides a clear path toward the specific support your child needs to communicate and engage with the world.
वीडियोस बनाने हैं, फिल्मोरा है ना।